Hi, my name's Chris Daley, and I'm a professor here at the College of Health at Lehigh University. I also co-direct the new Institute for Indigenous Studies here, something that's just being created this year that I'm really excited about. I've actually been working with Native communities for about 25 years. I'm an applied medical anthropologist by training, which basically means that I look at the intersection between culture and biology and how those two interact to create health in different communities. So as I mentioned, I work with Native communities here in the US, and I've worked in a variety of different urban and reservation communities in about 15 different states over the years. So I love working with Native people. The kind of research I conduct is called community-based participatory research. And what that means is we involve community members from the very beginning of research all the way through to the end. So developing research questions, deciding what we're going to do, that's done in conjunction with the community. And then as we develop the programs to help the community, they do it with us. So that kind of creates community empowerment and allows people to get really excited and have some ownership over the programs that are developed. Then we continue to include community members through the analysis phases and ultimately even to dissemination. And what that does is it helps us to make sure that when we disseminate the results of our research, it doesn't just go to academics, but also to communities, the communities who worked with us and other communities who might be interested in the kinds of work that we do. So my research focuses on a variety of different prevention types of things. So smoking cessation, weight control, healthy home environment, access to care. So we do a lot of different things that really focus on keeping people healthy, maintaining health, and preventing disease, which is where I prefer to be, kind of looking at those prevention kinds of things. In addition to my research, I work with the American Indian Health Research and Education Alliance, which is a 501c3 focused on improving health and educational opportunities for American Indians. We do a lot of work with scholarships and also with health programming, as well as education, just sort of health education, as well as education about college and the need for going to school and that kind of thing. So I kind of work in both the research and education realms with Native communities. I'm what's called a mixed methodologist by training, which means that I use both words and numbers to tell the story of my data. So I don't just do big quantitative things, big data sets, things like that. I also do things like interviews and focus groups and kind of bring those two together to create the best research. I love to bring students into my research as well. And by being a mixed methodologist, I can bring in a lot of different types of students, which I think is great. It gives people an experience that they can't otherwise have by coming out into the community and really getting involved in things. So research is something that I've always loved and always done, but really my passion and the reason I became an academic is because I love teaching and mentoring students, and that's students of all levels. From undergraduates to graduates. I actually worked at a school of medicine for 16 years before coming here. So working with medical students as well as graduate students and undergrads. I also do a lot of mentorship for postdocs, people who have completed their doctorate but aren't faculty yet, and for junior faculty members. So I love mentorship at all different levels. And I really try to bring all of my students and mentees into the work that I do to give them that hands-on experience. So that's very, very important to me. So currently here in the College of Health, I'm teaching a class on, shockingly, being healthy during a pandemic. I'm hopeful that this is not a class that I'm going to have to teach for very long, but it's something that has to be done right now. So I'm really excited to be able to offer that to students right now. In the future, I think you'll see me teaching a lot of different methods-focused classes, of course, CBPR, community-based participatory research, qualitative methods, mixed methods. So you'll see me teaching methods at a variety of different levels. Probably also a little bit of grant writing, because that is something that we as academics all do. This spring, in addition to a CBPR class, I'm also going to be teaching the biological basis of health. As I mentioned, my training is in biology and culture. So I'm going to be bringing that to the classroom, focusing on the biological basis, but really from an evolutionary perspective. Which is more of the anthropological perspective that I use. I'm also hoping to bring different Native health classes to students here at Lehigh, as well as some of these other specialty classes that I've done in the past, like altered states of consciousness and healing, shamanic healing, that sort of thing, and classes on medical mysteries. So I have a lot of different ideas for different types of classes that we can bring to Lehigh students. So I'm very excited to be able to start doing that. I'm thrilled to be away from a school of medicine and getting back into teaching students of all different levels. I think that's really exciting. And I'm very, very happy to be able to bring Lehigh students into the work I do through my research, through my teaching, and also through a variety of internship programs that we're going to be having through our Institute for Indigenous Studies. So hopefully those of you who are watching this are considering Lehigh and thinking about coming here, and I really hope to see you here and bring you into some of the work that we do. Thanks very much for listening.